We're very excited to be here at SwitchPoint. My name is Cheri Reynolds.
My name is Hannington Segirinya.
And we work hard every day because 5 billion people around the world don't have access to safe surgery. Watch this. Thank you. So I'm curious, how many of you have had a surgery? Maybe you've had an appendectomy, or you've had a bone surgically repaired, or you might have a family member who's had gallbladder surgery or open heart surgery. You have friends or colleagues. There's hands all over. Can everyone raise their hand if you've been touched by surgery in some way?
Wow. And just like you, when I was just 9 years old, I broke my arm and it ended up into an emergency surgery.
I also have been impacted by surgery several times. I had a close family member who had cancer removed. I had a broken ankle that was surgically repaired. And most importantly, my firstborn son's life was saved by a C-section.
We believe that everyone, everywhere, should have access to safe surgery or surgical care. But unfortunately, that's not the case today.
Today, we'd like to tell you 2 stories that show the inequalities that can exist between access to health care here in the United States, where I live, and the lack of access to health care in Tanzania, where Hannington lives. And while within surgery and even outside of surgery, there's many things in both countries to celebrate, there's also still a lot of work that ought to be done. So I knew ahead of time, I was very fortunate that I would need a C-section. I knew this because I had 4 ultrasounds when I was pregnant with my son. And it was on the final ultrasound that the doctor could tell that the baby was breech, and so we scheduled a C-section.
In rural Tanzania, it's extremely rare for a woman to know that she will need a C-section, just because there are no healthy, at the healthy centers, there are no ultrasounds to check.
So because my C-section was scheduled, I never went into labor.
In rural Tanzania, since a woman usually doesn't know her baby's breech, she goes into prolonged labor before she gets to the healthy care facility.
So the morning that my son was scheduled to be born, it was an exciting morning. It was a leisurely morning. We got into our car. My husband drove us to the hospital. We had family members waiting for us.
In rural Tanzania, in most cases, a woman will have to take public transportation. Sometimes they have to take a taxi or a bus to get to a healthy center. And in some cases, they go on a makeshift stretcher. And this could take 1 to 2 days. And in most cases, it's not all that easy. The family will have to sell some chickens or even a goat in order to fund the transportation bit.
So my health insurance paid for everything except for a $25 copay.
Once there, a woman may be able to see an emergency surgical officer, but oftentimes there is no an anesthetist or there is no oxygen, and this would put her life and the baby's life in danger.
It didn't even cross my mind when I arrived at the hospital that everything I needed wouldn't be there waiting for me. The surgeon was there, the anesthesiologist was there was oxygen, there was medication. Everything I needed was ready for me.
If she's fortunate enough, there will be an anesthetist on duty. This will typically be a person who has taken training for just 12 months and earns about $2,000 a year.
In the United States, an anesthesiologist has 12 years of training and a starting salary of over $200,000 every year.
In Tanzania, 546 out of 100,000 mothers die during childbirth.
And in the United States, while it's true the number is rising, still only 26 mothers out of every 100,000 will die during childbirth. This is a really big problem, and it's a global problem that kills 17 million people every year. That's 1.4 million people every single month, and that's 46,575 people that die every single day because they don't have access to safe surgical care. And these people are not just statistics, and they're not just numbers, but they're mothers, their fathers, their children, their family members, their community members.
We are from Assist International, and we are part of a GE Foundation-sponsored global movement called Safe Surgery 2020. And our main goal is to bring safe surgery to 50 million people by the year 2020.
So what do we mean by safe surgery? Safe surgery, basic safe surgery, are considered bellwether procedures. It's C-sections, it's basic laparotomies, and it's open fracture repair. And in order for us to move the needle for 50 million people by the year 2020, we know that we have to create and we have to innovate around the many gaps that are around. So we think about this word innovation a lot. And we're all here thinking about the word innovation, right? It's an oft-used word. It's certainly a buzzword. It has a lot of different definitions to it. Webster's defines it as the act or process of introducing new ideas, methods, or devices. I think that our favorite definition is this: innovation is the future delivered. And we know that replicating what we do in the United States certainly doesn't always work in developing countries, but rather we're looking for ways that we can leapfrog over current methods so that we can quickly close the gap around the world in providing safe surgery for everyone.
And we know we cannot innovate without our local partners. That's why at Safe Surgery 2020, we're working around 4 major areas. Around people, our partners, Japaigo, is training surgical teams to be leaders, to communicate better, to make quicker decisions in order to solve problems in a local way.
And around processes, we're training hospital staff around surgical sterilization methods and obstetric emergencies. And then we're enforcing and solidifying that training through remote mentorship.
Around technology, we are exploring ways of bringing surgical training skills to remote areas through the use of smartphones and tablet apps.
And then around business models, we're exploring how to shift from grant-funded models over to self-sustaining models.
One way we have been able to look at a serious problem is through our oxygen social business enterprise. You all know that access to oxygen is a serious problem in some parts of the world, and this can impact a hospital's ability to perform surgery. In many rural areas, hospital staff must travel over 8 hours in order to fill cylinders. This is time-consuming. This is a wastage of resources. And it takes away the health workers from their primary job of saving lives. We have worked with the local partners in finding solutions to overcome this devastating problem. That not only delivers oxygen to the door of a health clinic or a hospital, but also delivers a business model that will keep the oxygen program running long after we step away. And most importantly, it's an impact investment. We place an oxygen plant at a referral hospital that is in the middle of almost nowhere, where access to oxygen is really hard. And then we set up an oxygen business plant that will ensure that the hospital will have enough health workers to work there instead of wasting time looking for oxygen from faraway places. We deliver oxygen to the surrounding hospitals and clinics at an affordable rate. We also train healthcare workers on when and how to use oxygen. The money that is received from the sales, it will go back into the business to pay for the costs, the maintenance, to make sure that the business is moving well and it's self-sufficient. We have seen a tremendous increase in the oxygen consumption in the hospitals where we operate in. We have seen in certain areas that access to oxygen has moved from 3 days to just 3 hours. People in the healthcare business, you all know that increased oxygen use it means a lot and it's good news. Many unborn babies will be saved. Trauma patients will receive care. Very many surgeries will take place. And everybody will be happy.
So there's still so much that still needs to happen. There's so much that needs to create and innovate. Entire health care systems need to be strengthened. We need to innovate around blood banks and referral systems and delivery systems and training methods. And we need to be able to leapfrog over what we're doing and quickly get everyone up to speed. You know, there's so much power that we have at our fingertips in this generation, really more power than any other generation before us. And the question really is for us, what are we going to do with that power? We've heard people talk, you can use it for good or you can use it for bad. And so we want people to join with us, to create, to innovate, to tackle this huge problem, to look at access to safe surgery as part of universal health coverage, so that we can work together and realize that everyone, everywhere, can have access to safe surgical care, so that every mother around this world can have access to the same safe C-section that I had years ago, ensuring that their lives and their babies' lives will be saved. Thank you for your time.
Thank you very much.